Andy. Good morning, and thank you everyone for attending this morning. Today, I'm joined by leaders from healthcare, public health, small business, and the faith community to provide an update on the rising number of COVID-19 cases in Michigan, how we can work together to bend the curve as colder weather hits our state, and make sure that Michiganders are protected against COVID-19, the flu, and all other respiratory illnesses as we begin to gather with family and friends indoors during the upcoming holidays. COVID-19 is still present and spreading in our communities, and our hospitals are once again stretched thin. While some patients hospitalized with COVID-19 have been vaccinated, data and hospital census show us the vast majority are unvaccinated. As many as 72% of hospitalizations and 76% of deaths were among individuals who were not vaccinated. And even if you or a loved one doesn't need care for COVID-19, a surge can create a delay in care for other conditions or emergencies, including accidents, heart attacks, strokes, and other conditions. I want to extend my sincere thanks to all of our healthcare providers for continuing to care for those in your community. I know you are tired. I know this has been going on for a very long time, and I am so grateful for your continued dedication and commitment to caring for your neighbors. We are also seeing more cases and outbreaks of the flu this year, and along with it, hospitalizations and potentially serious complications in some individuals. The good news is that we know how to fight COVID-19, and many of the same strategies that work to prevent COVID-19 also help prevent the flu and other respiratory infections. It is critical that as we gather for holidays, visit with friends, go to work, and other places in our communities, that we all take steps to protect ourselves and avoid another surge in the coming weeks. Today, we are issuing a public health advisory that recommends that everyone over the age of 2 should wear a face mask at indoor gatherings, regardless of their vaccination status. In addition, establishments should implement policies to ensure that people entering or seeking services, including employees, are wearing masks. This face mask advisory takes effect immediately and remains in effect until further notice. If you haven't received a COVID-19 vaccine or booster yet, get vaccinated or get your booster dose and get your flu shot at the same time. Vaccines continue to be our absolute best way to fight COVID-19, reduce spread, and decrease the risk of severe illness, hospitalizations, and death. To date, over 5.6 million people in Michigan have received one of the safe, effective COVID-19 vaccines. More than 1 million additional or booster doses have been administered in Michigan, and just over 67,000 doses have been received by children ages 5 to 11. Again, the vast majority of COVID-19 cases, hospitalizations, and fatalities are among people who are unvaccinated. So if you haven't received that initial dose or doses of a COVID-19 vaccine yet, please make your appointment or walk into a vaccine location to start your series today. You can find vaccine locations near you by visiting vaccinefinder.org. If you are a parent or a caregiver of a 5 to 11-year-old, make sure they get vaccinated too. Children can get sick, spread the virus, end up hospitalized, or worse. If you are 2 months past a single dose Johnson & Johnson vaccine, or 6 months past your second dose of a Pfizer or Moderna vaccine, we urge everyone to make an appointment or walk into a vaccine location to get a booster shot, as we expect the federal government to authorize that. If you haven't received your flu shot yet, you can get your flu shot and your COVID-19 vaccine at the same time. Many locations that offer the flu vaccine also offer COVID-19 vaccines. Each year, the flu vaccine does prevent millions of illnesses and thousands of hospitalizations and deaths. So far this year, only 22% of Michiganders have received a flu shot, and now we're seeing some outbreaks in some communities. The flu vaccine is the best way to reduce risk from the seasonal flu and its potential serious complications. Stay home if you're not feeling well or have symptoms of illness, and if you can, find a way to join friends and family virtually. Even if you are already vaccinated, practice physical distancing when possible, especially when you're in public spaces where vaccination status of those around you is unknown. Get tested before and after traveling during the holidays if you have symptoms or if you think you may have been exposed. Wash your hands often with soap and water or use an alcohol-based sanitizer. And if you do test positive for COVID, make sure that you remain isolated. Tell your close contacts right away so they can get tested and quarantined. You can also talk with a doctor about whether you should get an antibody treatment. Antibody treatment is authorized for people who meet some high-risk criteria. In addition to these steps individuals can and should take, we continue to strongly recommend that local officials consider CDC guidance regarding the adoption of mask requirements in schools in combination with other strategies that reduce the spread of COVID-19, maintain consistent in-person learning, and protect people who are not yet fully vaccinated. And that workplaces continue layering mitigation strategies, including those cleaning protocols they've had in place. Today, we are at another crucial point. We have a chance to turn the tide and these rising numbers around, and we have done it before. But whether or not we do will depend on everyone in Michigan. All of us here today, public health, healthcare, business, and faith communities, have come together to urge everyone to take these simple but important steps to help protect themselves, their friends and their families, workers, people who are not yet eligible to be vaccinated, and some of our most vulnerable individuals around us this holiday season. Now I will turn it over to Dr. Bagdasarian, our Chief Medical Executive in the state of Michigan. She will provide more information on some of the trends that we're seeing across the state.
Thank you so much, Director Hertel. I do have some slides to share with you all. And Andy, if you wouldn't mind showing those. Can everyone see those slides? Okay. Thank you so much. I would like to share with you some of our COVID-19 metrics, which are all looking quite troubling. And so what we'll start out with is our COVID-19 percent positivity. As you can see here, our percent positivity is at 16.8% across the state, and this number has been continuing to rise. In some regions, this is over 20%. What this indicates is that more people should be seeking testing during this surge, and it indicates that we could be missing cases of COVID-19 in the community. Next slide, please. Next, we'll talk about case rates. Over 489 daily cases per million are being reported. 6 regions across the state have reported over 500 cases per million. And on November 18th, we reported over 10,700 cases, that's confirmed and probable cases, in a single day. This number continues to trend upwards. Next slide, please. We'll talk a little bit about inpatient beds. This is also trending up, and currently over 15% of hospital beds across the state are being used to care for COVID-19 patients. This is only one measure of strain on healthcare and doesn't factor in increases in non-COVID hospitalizations. Next slide. This slide demonstrates how we're doing this year compared to last year. So you can see the line in light blue is this year, and the black line is last year. What this really tells us is that case rates are now virtually at the same point at this time last year. The trend is following the same rapid rise that we experienced last fall, and with holidays around the corner, this is especially concerning. Next slide. The next slide, I know, is a little bit difficult with so many colored lines, but what this really tells us is that cases are increasing across all age groups. What we saw was an initial surge in pediatric cases shortly after schools reopened, but the surge has now spilled over into other age groups, and we are seeing widespread community transmission in all age groups. Next slide, please. Again, a little bit about our statewide hospitalization trends. The number of COVID patients taking up beds in our hospitals is now more than 2/3 the level we saw in the spring of 2020, and it's continuing to increase. Pediatric COVID hospitalizations are almost at the highest point to date. And again, this doesn't begin to tell the full story of how much strain the hospitals are under, which you'll hear about next. Next slide, please. A little bit of good news are the COVID-19 vaccination trends. At this point, more than 70% of Michiganders 16 and over have had an initial vaccine dose. We're also ranked 7 in the nation for booster doses administered. We're over 1.1 million doses. And 42% of our fully vaccinated population ages 65 and up have received a booster dose. So that's really good news. But vaccine uptake has not been as strong in our younger age groups as it has been in our older adults. We now have a safe and effective vaccine approved for those over the age of 5, and we continue to encourage everyone to receive a dose of vaccine as soon as possible if you haven't already. We are making strong progress with our vaccinations in 5 to 11-year-olds, and over 9%, this is actually a very recent number, what we know is today over 9% of our 5 to 11-year-olds have received an initial pediatric dose, and that's approximately 74,000 doses. Next slide, please. In terms of influenza, we are seeing influenza outbreaks, even though this is relatively early in the season. In terms of influenza vaccination, we've administered 2.2 million doses so far this season, and that's far short of our goal of 4 million doses. It's less than where we were at this time last year, and I encourage all eligible Michiganders to get a flu shot this year. In summary, our COVID-19 metrics are extremely concerning across the state. We're seeing widespread community transmission in all age groups. We're seeing troubling trends in other seasonal respiratory viruses, and our healthcare systems are feeling the strain. I encourage all Michiganders to do their part. And with that, I will hand over to Dr. Mushi from Spectrum Health. Thank you.
Thank you so much. I'm Daryl Mushi, president of Spectrum Health in West Michigan, and I want to paint a picture of what's happening in hospitals across the state. I'll start by saying all hospitals across the state are incredibly busy, and I'll paint a picture of what's happening here in West Michigan, but it's echoed definitely on the east side of the state and up north. What's very different about this surge than other surges is that our hospitals have been incredibly full for months with non-COVID patients with a lot of illness. Hospitals, when they start getting full, and then you add COVID on top, sometimes can stretch thin. And across our state, we've seen hospital after hospital sitting at or over 100% capacity. This has been going on for so many months, it's putting a strain on healthcare resources, on caregivers, and is quite difficult. The other thing I'd point out from the graphs of Dr. Bagdasarian was that we had a high baseline over the last 2 months of COVID. While we're seeing an abrupt increase over the last 1 to 2 weeks, we've been sitting in Michigan with high percentage positive really since the end of the summer going into fall. That's made it very, very challenging for all of us. Additionally, I'd say that the pediatric cases that we're seeing here on the west side of the state specifically have been significantly higher and significantly sicker than we've seen before. This week at our Helen DeVos Children's Hospital, we reached a high mark of 19 inpatient kids with COVID-19. Additionally, and this is very challenging for so many of us, many of the health systems, including ours, we have 14 hospitals on the west side of the state, yesterday made the decision to move to what we call red status. This essentially refocuses all of our efforts on our inpatient care, on our urgent cares, on our emergency departments, and on delivering monoclonal antibodies. Many of us have had to curtail services such as deferring surgeries and other important procedures and redeploy staff. And if you imagine hospital staff for the last year, we've been dealing with a lot of non-COVID care and increasing amounts of COVID during these surges. It's almost like we're running a marathon and the finish line keeps pushing back. Most specifically and most importantly, I'd like to show a slide that demonstrates for us what we're seeing in terms of our hospitalizations and vaccinations. Andy, if you can show the slide. So this is our data as of a few days ago. And as you can see here, of all of our inpatients across our 14 hospitals, 86% who have a diagnosis of COVID-19 are unvaccinated. In our ICUs, 90% are unvaccinated, and on ventilators, 97% are unvaccinated. Further, those patients who are vaccinated are significantly older and have many more comorbidities. We are seeing healthy young people in our hospitals very sick, on ventilators, and even dying with COVID-19. The vaccines absolutely work, and we absolutely, without a doubt, would recommend everyone to reconsider if you haven't been vaccinated, and if you haven't been boosted and you're eligible, by all means, please get boosted. With that said, I'd like to turn it over to Justin Winslow, President and CEO of the Michigan Restaurant and Lodging Association, for more comments.
Thank you. Thank you, Dr. Mushi, and thank you to Director Hertel for the opportunity to speak this morning. My name is Justin Winslow. I'm the President and CEO of the Michigan Restaurant and Lodging Association. So we head into the holiday season. Our natural desire to gather over great food and drink kicks into overdrive. You got family gatherings, you have friendly reunions, and a lot of office parties that we maybe didn't have last year. So as we head into that season, it is so critically important that we do so responsibly and with a mindset that takes into account the health and well-being of our fellow Michiganders. A lot of us may be done with COVID, but despite our best efforts and a lot of sacrifice, it doesn't appear to be done with us. For the sake of the many restaurants, hotels, and other small businesses that have sacrificed for the rest of us these past 18 months, we are hopeful you will consider some simple, reasonable steps while dining out this holiday season to help get us through this period. If you're planning to dine out and feel more comfortable in a mask, wear it. We encourage it. A mask might not make you invincible, but it is a pretty simple tool to help mitigate spread and keep your fellow Michiganders safe. And a little bit of social distancing can go a long way. Don't cancel your dinner, but just spread out a little bit more. You'd be surprised how much that can do. And finally, I know you've heard this before, but you're hearing it from me today, get vaccinated. Again, a vaccine might not make you invincible, but it dramatically diminishes your chances of experiencing severe outcomes, which means you'll be available for all of the holiday festivities we talked about earlier. So it is important to remember that the hospitality industry has taken extraordinary steps over the last year and a half to ensure a safe environment for you and your loved ones. It shows in the data, which is why there are currently 0 COVID outbreak investigations involving a restaurant patron. But for those of you who do not feel safe in a restaurant this holiday season, this industry has more carry-out and delivery options than we ever have before. Turkey, mashed potatoes, and gravy, they travel well. Trust me, go for it. So as I conclude, I'll just say, please support our community restaurants this holiday season by making sure you're being safe and you're taking into consideration the health and well-being of all your fellow Michiganders. Thank you. With that, I will kick it to Reverend Chapman.
Thank you, Justin. And to Andrea Poole, Vice President Poole, Director Hertel, and all of the participants on this panel, to those who are observing and listening. I'm Tellis Chapman, pastor of the Galilee Baptist Church of Detroit and director of the Pastors and Ministers Division of the National Baptist Convention USA Incorporated. Today marks a great opportunity for Michiganders to set the bar for mitigating the COVID-19 pandemic. As the autumn season is ending, we're on the cusp of winter and are facing greater risk of exposure to viruses, that is COVID-19 virus and the flu, and largely because we are enclosed more now than ever. I believe, however, we can do this by exercising 3 things: faith in God, trust in medical science, and common sense. These practices include wearing a mask when around others and getting vaccinated. And for those who are vaccinated, get the booster. This goes especially for, at least from my vantage point, the faith-based community. That goes for Jews, that goes for Muslims, that goes for Protestants, it goes for Catholics in all of our worship settings and funerals. This is not a political issue. It is a matter of life and death. It is not a religious issue. It's not a First Amendment right issue. All of us who gather in mosques, in synagogues, in temples, and in churches, sports venues, schools, universities, shopping locations, and travel endeavors, we must employ every means necessary to mitigate the pandemic. Let us not forget, the gravity of this pandemic upon our economy, jobs, income, inflation, just to mention a few, have all been affected, and the devastating loss of loved ones already. Let us take into mind that this matter of fate is in our hands, and we can do this together. With that, I turn it over to Director Hertel.
Thank you so much, everybody. I really appreciate everyone being here. And I think Andy may be moderating questions at this point.
That is correct. Thank you, Director Hertel. We have a few coming in already to the Q&A function and in the chat. So please be patient as I get through. We also have some people that are using the raised hand function. I just ask if for everyone to check to see if for some reason you had your hand up and didn't mean to. We had a couple people join that started the conversation with their hand up. So just a moment and I will call on you. So first from the Q&A, we had a question. Now that the state has hit the initial 70% vaccination goal for people 16 and up, is MDHHS considering setting a new goal around vaccination rates, seeing as we are in another wave of COVID-19 cases? And is there a concern that the messaging around the 70% goal may lead people to believe we have reached herd immunity in the state? And I'll direct that question to Director Hertel.
Thank you. We are very excited that we did reach our initial milestone of 70% of eligible Michiganders getting at least one dose of the vaccine. However, as we are seeing, that is not achieving herd immunity. And our goal at the Department of Health and Human Services is to try to support everybody in the state who is eligible to have access to getting one of the 3 safe and very effective vaccines. And we will continue our work to do so.
Great, thank you very much. The next series of questions are around vaccinated versus unvaccinated hospital populations. This person was asking if we have the statewide numbers for vaccinated versus unvaccinated hospital patients. Dr. Bagdasarian, I'm not sure if you have that available, but could you speak to some of the trends that we're seeing?
This surge is definitely affecting those who are unvaccinated significantly more than those who are vaccinated. So looking at the last 30 days of complete data, 73% of cases, 72% of hospitalizations, and 76% of deaths were in those who were unvaccinated or not fully vaccinated.
Great, thank you. Another question from the UP. Can you speak to the specific challenges in rural healthcare with transfer availability outside the UP and staffing shortages? Director Hertel, would you like to take that one?
Actually, I think I'll defer to Dr. Mushi on that. He has direct experience.
Yeah, that actually is a great question. And we have multiple rural hospitals across West Michigan. So just as an example, first of all, we're seeing significant amounts of COVID. Some of our rural hospitals, their emergency departments have up to 15 or more patients that are actually admitted and can't get beds with COVID in the ERs, can't get upstairs or into the hospitals. And then in terms of transfers to other facilities, that is probably one of the most worrisome aspects of what's happening now. Just about every hospital in the state is full. And so not only are we having difficulties with enough EMS and other transfer abilities to get patients to different hospitals, but so many hospitals are full. When you need a higher level or different level of care, it's very challenging for a small hospital to find a hospital that has availability to transfer to. So this not only impacts COVID patients, this impacts patients that show up to any hospital with a condition like a heart attack, a stroke, car accident, and so forth. And this is what we talk about when we talk about straining the entire healthcare infrastructure of a state or region.
Thank you very much. Another question. What is your advice for gathering at Thanksgiving? Should people be inviting others over? And Director Hertel, I'll have you take that one.
We would recommend this year that you do try to limit gatherings. If you are aware of people's vaccination status, it's clearly safer to be gathering with people who are fully vaccinated. If you're with people who are not fully vaccinated, wearing a mask is a great idea. Trying to ensure that you're in areas that are well ventilated. Having Thanksgiving outside may be a little difficult, although some people might enjoy that. So maybe opening a couple of windows in the house so that you're getting air through as well would be extremely helpful. And again, utilizing those good hygiene practices of frequent hand washing and cleaning of surfaces is so important going into this holiday season.
Thank you. Another question here. When it comes to schools dropping mask mandates, does this advisory apply to them? And will they have to reinstate this mask mandate for students and staff? That question can go to Director Hertel.
We certainly continue to encourage all schools to have students masked in the classroom and other indoor activities together to help minimize transmission and keep those populations safe, especially because children age 5 to 11 were only authorized to receive the vaccine a couple of weeks ago. Many of those students remain unvaccinated. The advisory is a statewide advisory to make sure that people are aware of how serious this COVID-19 surge is, and to make sure that they are able to take the steps needed to protect themselves and their loved ones this holiday season.
Thank you. Some doctors in the Detroit area have indicated that this surge may last 3 to 4 months. Do you have predictions or thoughts on how long this surge could last? Dr. Bagdasarian, could you speak to that as you spoke to the numbers?
Happy to speak to that. I think it's really hard to predict what's going to happen with this virus. We're clearly dealing with a variant that is more transmissible, and it's holiday season, people gathering indoors, and that can lead to increased transmission. It really depends on people's behavior. I think if we can change behavior and if we can get people to start masking and increase those vaccination rates, we have hope of this ending soon. If behavior doesn't change, I think we're in for a very rough winter season.
Thank you. Another question here in the Q&A. Does the FDA's authorization of boosters for all adults and what we know about waning immunity from additional doses redefine who is considered fully vaccinated? Dr. Bagdasarian, can you speak to that?
At this point, we haven't redefined who is fully vaccinated and who isn't. But as we learn more about immunity and about how vaccine immunity lasts over time, there could be changes in that definition. We do continue to encourage everyone who has not received an initial dose of COVID-19 vaccine to get vaccinated. And for those who are eligible for boosters, and pretty soon that's going to be really opened up to a lot more people, we encourage everyone eligible to get a booster as well as soon as possible.
Thank you. Another question. We often hear, I've had COVID and therefore I don't need a vaccination. Do we know if any of our hospitalized people are having a second infection? And can you speak to that? Dr. El-Mushi, I'm not sure if you have access to this type of data for Spectrum, but could you speak to any of those trends you're seeing?
I can speak to Spectrum, and then if Dr. Bagdasarian or Director Hertel have anything more to add, please do. We have seen a small number, but a true number of reinfections hospitalized. There's clearly some protection afforded from initial infection, but the data is very clear that vaccination on top of infection is incredibly effective. And at the end of the day, would absolutely recommend that everyone be vaccinated in spite of prior infection.
If I could just add, number one, to echo what Dr. El-Mushi said, but if I could just add to that, one of the things that we don't know is how long-term natural immunity is going to last. We don't really have the data on that. We have much more clear data on vaccine efficacy and the vaccine-mediated immunity. So the vaccine is a much more surefire way to ensure that you're protected against this virus.
Thank you. Is the state seeing a difference in case rates and vaccination rates between racial demographics? And Dr. Bagdasarian, can you speak to the data we're seeing on that?
We do continue to see some differences in terms of racial and ethnic groups and vaccine uptake. One of the most striking differences that we see, however, is across age groups. And I alluded to this earlier, but our vaccine uptake is much higher in those over the age of 65, and then it drops down across age groups. So not only are we seeing differences in terms of people's racial and ethnic background, but we're also seeing this difference in terms of who's getting vaccinated across the age spectrum. And that's important for a couple of reasons. Number one, it's fantastic that so many of our older adults are vaccinated. It means that they're not getting the serious outcomes, the death and severe hospitalizations that we were seeing earlier on in the pandemic. However, it means that our younger age groups who are at high risk of transmitting virus to lots of people, going to schools, going to large gatherings, we're not seeing the vaccine uptake in those age groups. So what we really need to do now to ensure that we nip this in the bud, that we don't continue to see a surge in cases, is to really ensure that we have vaccination across all groups, across all racial and ethnic groups, across all age groups.
Thank you so much. We've had several reporters ask this question along different lines, but this question will go to Director Hertel. In general, it's why a statewide mask advisory instead of a mandate?
Right now, we know the most effective ways to mitigate transmission of COVID-19. We've learned so much throughout the last 21 months about COVID-19, how it is transmitted, and how we can prevent that transmission. One of the most effective ways to do that, the most effective way to do that, we know, is for everyone who's eligible to get vaccinated. And if you've been vaccinated and are eligible for a booster shot, to go get your booster shot today. As we continue to learn, we also were able to get new tools in this fight against the pandemic. And we've all been armed with the information that we think we need to have in order to keep people safe. So at this point, we feel that it is most prudent to make sure that people are aware of how serious this COVID surge is right now, and give them the ability and information to take steps to protect themselves and others through a public health advisory.
Thank you. This is kind of along those same lines, Director Hertel. Does MDHHS have plans to implement stronger approaches as cases trend, if and when cases trend upward, and if they continue to rise post-Thanksgiving?
As we have throughout this entire pandemic, we do continue to watch this data very closely, which is what brings us here with you today, because we are seeing a significant spike after some slowly elevated case rates in the fall, and a very quick increase in case rates and hospitalization over the past few days. After Thanksgiving and throughout the holidays, we will continue to watch those case rates and other indicators very, very closely and make determinations as we see what transpires across the state. However, it is my most sincere hope that Michiganders will take this message very seriously going into the holidays as they start meeting with their close friends and families and the people that they love, and do everything that they can to protect themselves and the people that they are around.
Thank you. This question I'll direct to Director Hertel as well. Is there a point when the state might seriously consider requiring masking in schools instead of letting each county or school district decide? And I'll let you take that one.
Sure. Unfortunately, I can't predict the future. And what we've all learned is that we really can't predict the future when it comes to COVID-19. So the best I can answer that is that we'll just continue to watch what's happening across the state and continue to make determinations based on that.
Thank you. I'm sorry, I'm just going through some and seeing what we've. All right, so we have a question here. Most of the people who still haven't gotten vaccinated by this point likely won't be getting vaccinated now. What is the state's plan to address this ongoing problem? Is the state considering implementing showing vaccine cards at large public events or in businesses? Director Hertel, I'll have you address that.
I don't know how accurate this statement is that people who haven't been vaccinated by now won't get vaccinated. We are working at the state, along with all of our community partners, including our hospitals, healthcare providers, local health departments, small businesses, the faith community, and others, to make sure that people who do have questions and may be uncomfortable with the vaccine are getting those questions answered in an accurate way, and that we are supporting them to make this decision and feel comfortable with it. And we will continue to do that work until we've reached everyone in the state of Michigan and made sure that they have access to accurate information about the vaccines.
Thank you. And we have a couple people that have raised their hands. Robin Erb, I am happy to allow you to talk if you still have a question.
I do, thanks. I'm sorry, I didn't realize my hand was still raised even after you said that. I did have another question though. We're told that testing is so important, especially as the holidays come up. I think a lot of people are talking about like at-home tests, but $25 is a lot for families. Can you tell us about any plans you may have to make testing, at-home testing more available to Michiganders? Is there a plan?
Dr. Bagdasarian, would you like to talk about that?
Happy to talk about that. We definitely see this as a challenge. Not only is the cost of over-the-counter tests a challenge, but recently supply has been a challenge. What we'd really like to see here at the state level is making these types of tests available to families, to households, anytime they really feel that they need one. So anytime someone in the household is symptomatic or feels that they've been exposed. We're starting a pilot program this week, the My Backpack testing program, where we're putting over-the-counter tests into the hands of families. So these types of testing kits will go home with students. It's a completely voluntary program. So schools are able to opt in, and families are able to opt in if they want these types of tests at home. It's one more tool to keep our schools safe, to keep our young people safe, to keep our schools open, and to support families. So that's actually starting this week. And hopefully we can expand that program based on interest and based on supply of these tests. Thank you.
Great, thank you very much. Rachel Just, do you still have a question as well?
Yeah, can you hear me okay? Yeah. I do have a question. I just wanted to see if maybe Director Hertel could explain to me. As Dr. Bagdasarian was pointing out, we do see very similar case rates to this time last year, but we have so many more people who are vaccinated now. So if you can just explain why these numbers are still so high.
With the advancements and the additional tools that we have gotten over the last year, including vaccines and other therapies, with the reduced case rates that we saw over the summer, and with, I think, just the basic fact that everyone is a little bit tired of COVID, my concern is that people have maybe let their guard down and are not taking the mitigation techniques as seriously as they were a year ago. So even with the number of unvaccinated people that we do have, we are gathering more. We are going to large venues with big groups. We may not be wearing masks as often. We may not be thinking about washing our hands or using hand sanitizer as often. And we're seeing that not just with the COVID-19 transmission, but with the number of colds that we're seeing, the flu outbreaks across the state, the cases of RSV that we're seeing in younger children. All of these viruses are transmitted the same way. And seeing all of those numbers rising indicates to us that maybe the mask wearing and the other mitigation measures that we are recommending here are not being practiced as often or as thoroughly as we would hope.
Thank you so much. One final question. I'm going to direct this one to Dr. Bagdasarian. Is there anything in the data that that might tell us, if any of the current surge is related to schools and maybe students that aren't being required to mask?
We definitely saw that in the data. What we saw was a rise in cases when schools reopened. That rise in cases was predominantly in 5 to 18-year-olds, so school-age children. They led the surge, and then there was spillover into other age groups. All of those children are coming home from school to families, to parents, grandparents, siblings, and so there was spillover. We know that household transmission is very real and causes a lot of cases. So we saw that, and our partners at the University of Michigan looked at cases in schools with strong mask policies versus those without strong mask policies. And what they saw was that there were more cases, there were higher increases in cases, more outbreaks in schools that did not have mask policies. So yes, we absolutely saw that. And I think that contributed to where we are now.
Thank you so much. I really appreciate, I think we've covered most of the questions. And we need to wrap up, but I want to again thank all of our speakers and to everyone who attended today. We're going to be sharing the press release with you all if you haven't received it already. I'll be sending an additional email with that. I've also placed my phone number and my email address in the chat, so please feel free to reach out to me if you have additional follow-up questions, and I will do my best to direct those to the appropriate person. With that, I hope you all have happy holiday, stay safe, and thank you again for joining us this morning.
Thank you, everyone.
Record.